If you want to know why you dey feel the way they feel inside your mind, inside your brain, and generally why things dey the way they around you, Mind Clinic na the radio program we go teach you how to deal with all different types of stress and other things wey person dey go through. On top Mind Clinic, you fit talk about mind matter wey concern you directly or the one wey no even concern you directly.
Like I said earlier, 20th of October can never be forgotten in Nigeria's history. A lot of persons are so sad. Some could not get as much as 4 hours of sleep all through last night till this morning with the very gory pictures. When you wake up for a bit, you can't even deal. A lot of people who came out to protest peacefully, lost their lives. There are some persons who are excited about what happened in Lagos. They are like, they deserved it. And I'm like, how did we lose, human sympathy? Your mind needs to be stable and put together in as much as, yes, there's a lot happening in the country at this time, but you need to guard your mental health very, very jealously. You must try as much as possible. If you know that you can't stand the pictures and videos, please stay away from it. All right? Your mental health is key. Your mental health is important, so you don't get, a mental breakdown or depressed and all of those things in between. My name is Victor Pepple, usually at 8 o'clock. I'm always joined by the ever beautiful and ever amazing Chinyere Goldensi. She is on the show again today. Good morning.
Morning, Victor. I'm glad you're setting up this conversation. We're talking about what happened yesterday and what has been happening. And I'm glad you mentioned the need for everybody to actually take care of their mental health, because that's very important, especially in these times.
Exactly. A lot of Nigerians might not be so happy, but that's why we have the program this morning. And so on the program this morning, we're looking at investing in your mental health. We started that about 2 weeks ago, talking about investing in your mental health. But today, we're looking at that as an institution or organization, investing in your mental health as organizations and institutions. Joining us on the program today is founder Mandate Health Empowerment Initiative, someone who is passionate about humanity span across mental health and, psychological support, psychosocial support, as well as drugs misuse. He is an alumnus of the West Africa Mental Health Leadership and Advocacy Program 2017, doubles as humanitarian worker, specialist in community development. His project director on drugs prevention, treatment and care program funded by the EU, and has led MHEI to become a member National Protection Sector Working Group of the UNHCR Nigeria. He's also program director with Speak Your Mind campaign for United for Global Mental Health. He's a staunch mental health reforms activist committed to the Nigerian Mental Health Bill and convener of the Africa Mental Health Reforms Consortium, with over 10 African countries and 50 members on board. Our guest on the show, like I said, founder Mandate Health Empowerment Initiative, Ame Zion Abba. We're very glad you're able to join in this morning.
Thank you very much for having me on this program.
Great. Thank you. So, can you hear me?
Yeah, I can hear you clearly.
Okay, good. I'd like to please start off with asking you to give your 2 cents to the people listening with regards to what they can do to take care of their mental health during this trying period that we're in as a country.
Oh, thank you very much. I think that's a very good platform to begin this program today. My fellow distinguished Nigerians, my word to all of you is that at this particular critical time, it is very important we take care of our mental health. You might not probably have witnessed or maybe be experiencing any physical health challenge from all the ups and the downs within the few weeks or days that have passed. But then there is an aspect of your health that I will applaud you to please give attention to this moment, and that is your mental health. Of course, I know with all of this happening, the issue of anxiety, the issue of fear, the issue of worries, and from the activities that might have happened, some people are already even, beginning to sink into depression. So whatever it is that your own case scenario at this moment, please prioritize and give attention to your mental health. If you need to reach out to, quite a lot of toll-free lines on Twitter and social media. Ours also there. Please take advantage of it. I got a lot. We got a series of calls yesterday from Nigerians from so many states seeking, for psychosocial support, and that's fantastic. Please, that should be the way to go right now, because your mental health is very important. For the forefront of this campaign, of this call to action, it's also very important to your personal productivity and functionality. So please, let's give attention to our mental health and seek the right help to manage the various spectrum of emotions that is coming up at this moment.
Yeah, definitely. Thank you. Thank you for those words. Thank you. They're very useful, especially in this period. Thank you for that. So let's get back to, let's continue with our topic of conversation. We're talking about investing in your mental health, which is very apt for the season that we're in. And I think I wanted to start off with asking, what have we been doing wrong as organizations and institutions when it comes to taking care of our mental health? And what have we been doing wrong?
Okay, well, from my perspective, one of the things I would see that we're doing wrong or wrongly as an institution or organization is failure to prioritize the issue of mental health in our various organizations. It's failure to realize or to recognize the importance of mental health to the optimal performance of our staff, or even ourselves as business owners or entrepreneurs or even government. It is failure to rightly prioritize the place of mental health in all of our endeavors. So that is what, for me, I feel is wrong and is a huge gap that needs to be filled, or else, we will be seeing very, very low performance. We'll be seeing people or staff or workers or businesses underperforming, right? I hope we talk about the consequences maybe as the program progresses.
Yeah. You can actually talk about the consequences now.
Okay. You see, two things. Talking about the consequences, with respect to lack of prioritization of mental health in the workplace, for me is that there will be a huge loss of manpower. There will be a lot of absenteeism. There will be a lot of inability to meet up with the standard or the requirement or the outcome as expected of the organization or the individuals involved. And the two things I'd like to say quickly with respect to these consequences is, one, business owners, entrepreneurs, government, even as much as you want to drive for profit, which is why you are existing as a business person, even if that is your core and that is what you want to see happen, I'd like to please encourage that you prioritize mental health investment in your organization. That you prioritize the issues of training, the issues of getting people to educate your HR management and the staff on issues around mental health. As you drive for profit, as you drive for performance, as you drive for results, which is what I always encourage, because I'm also a result-driven person. But however, please give room to mental health investment in your organization. it is no longer tenable to say that ignorance is what is keeping us aback or maybe making us not to prioritize or to consider the issue of mental health seriously. I mean, conversations around mental health have been springing up, have been actually on the increase. So please, business owners, in as much as you would be result-driven, in as much as you want your staff or your employees to engage and to deliver results, please consider their mental health. Please prioritize their mental health and choose to invest as an entrepreneur, as a business owner, as a government to the mental health of the people that are within your sphere of endeavor or business.
Yeah.
So that's one of the things that I would like to quickly say, right? Of course, the list is endless, you know, talking about the consequences of lack of commitment or lack of investment in mental health. Okay? Because the issue of stigma, the issue of, you know, loss of job, the issue of a lack of prioritization or recognition or maybe observing the rights of humans who are working with you or who are working for you or who are working, you know, at your respective organizations or workplaces is very critical. Right? So among few other consequences is that when mental health is not prioritized, you will definitely see that the human rights of the people who work for you or who are in your organizational circle will not be respected. That's why you see the issue of people, because they come down with one mental health condition or the other, they have been sacked, they have been fired, they have been, you know, they have been stigmatized, they are being disenfranchised from holding some particular offices or positions. I mean, so these are things that we need to understand. We need to, you know, open up and increase our knowledge so that it will help us to become better or best managers in our respective organization. Because by the time you are stigmatizing someone because it's mentally ill or they have come down with mental illness, I mean, it's not good, it's not fair, right? Because all of us are open and susceptible to coming down with mental health illness at any time. It is not a stone that it is this particular person of gender or person or race or ethnicity that will come down with mental illness. So why do we have to stigmatize? Why do you have to discriminate? So these are some of the things we see happen as a result of lack of prioritization of mental health in the workplace.
Yeah. Definitely. I mean, so often, like in the past, a lot of the times, a lot of the concentration of the focus has been on the economic growth and the productivity of organizations, and little attention is paid to the people who drive that productivity and who drive the growth of the organization and for institutes too. So the conversation that we're having now is that we try to let organizations and institutions know that investment in the people who are being productive or who are increasing the productivity in your organization or your institution should actually it should surpass the need for growth or need for financial and wealth creation, because in investing in the people, you're indirectly investing in your organization and you're getting more from the people. That means you're getting more for your organization or for your institution, wherever it is. But I think we should go down to the basics of how can organizations do this? How can they invest in mental health support? How can institutions play a role in investing in mental health support?
Okay, thank you. One of the features and the easiest ways that institutions and organizations can be committed to investing in mental health is to look out for the welfare, the health welfare of her staff. You know, the HR management must maintain, regular or periodic mental health assessment for her staff. They must also look out for creating and using environment that will support, the emotions and the feelings that this staff will be having towards the work attitude. Because until the welfare of staff are being considered, let me quickly say here that when we make reference to welfare for staff in organizations, we're not simply or only talking about money or financing. We're talking about expose them to training, give them opportunities to be trained and to be informed about mental health. Give them opportunities to be exposed to knowledge and the literature of mental health, vis-a-vis how they can be optimally productive in the workplace. Give opportunities to training that will expose them to how they can identify their potentials. I can tell you that if you choose to invest in mental health as an institution or organization, the optimal productivity of the staff will be fantastic. Because, mental health simply is letting people to understand their abilities and potentials. Helping them to develop mechanisms to be able to cope with stress. Helping them to be productive and to contribute to the community. So if these four things are present in your staff, I can tell you will get and enjoy the best from them. Because you will be having staff that will have been able to fine-tune and discover their talent and potential. You'll be having staff that have been able to have been taught on how to come up with mechanisms to cope with stress. You'll be having staff that will understand how to be productive, how to be very productive, and how to contribute irrespective of their skill sets. How to understand the settings and the platforms that they can display their skill sets. So this is very, very important that institutions and organizations understand. And this is how they can begin to show commitment to the mental health, to the mental well-being of their staff, especially again by committing to training, by committing to investing in expanding the knowledge of your staff, by expanding, the mental health literature of your workers.
Yeah, great.
Because I'm glad I tell you something. In the workplace, it's been estimated that as many as 20% of the world's working population have some form of mental health conditions at any given time. This is serious. And with an estimated of 12 billion productive days lost to each year due to depression and anxiety alone.
Yeah.
So it says that, investing in mental health at the workplace is something that is going to be very profitable. Very, very profitable, because already the research has very proved that there is a gap, there is a problem. Okay? And poor mental health, as it is right now, costs the world economy approximately $2.5 trillion every year. And not only the loss of this approximated amount, but also it's interesting to know that it also reduces the economic productivity. And the direct cost of care is what we're talking about here. So it is very important that, business owners, entrepreneurs, government give attention to prioritizing mental health in the workplace.
Yeah.
And it might actually, again, interest our listeners that, the cost, is, again, being projected to rise, to increase to $6 trillion by 2030, alongside increased social costs. So you see, we're talking about a serious issue here. We're talking about something that will really affect not only productivity, but development across all sectors. So it's very important that we give attention and adequately, fund mental health systems across the workplace.
Hello?
Yes.
Okay, great. One of the things I'm actually glad that you mentioned was commitment. It speaks to deliberate actions. It speaks to very conscious effort and not just giving half-hearted plans or just letting people just be. So institutions and organizations need to make a very deliberate action and take deliberate steps into making sure that the people who are functioning within their systems or within their organizations have their mental health taken care of, or their mental health being invested in. And I'm glad you actually pointed out the consequences of not doing that and how much of an impact it can actually have on us. It would have way more negative impacts than we expect. So before we get to the other part of the conversation, I'd like to ask Victor if there are any questions or if there are any calls or any inputs at the moment.
Yes, we have a message here, no name, says, can you talk about how companies and organizations can train their staff on mental health?
Sorry, Victor, did you ask how can organizations or companies train their staff on mental health?
Yes, I think the listener is asking that you ask the organizations to begin to train their staff on mental health. Your input on that.
Okay, yes. We can't overemphasize the need for training, the need to expose your staff or your workers to the realities around mental health, especially in this time that we're in. You might be aware that mental health, typically rises during economic recession. Therefore, see, mental health as well as physical resilience is the face of uncertainty in critical times as this. And it is very important that business owners and entrepreneurs, should begin to seek collaboration, partnership with mental health facilities, mental health organizations, mental health institutions to enjoy collaborative, activities in terms of support. And this support, I refer to trainings, giving trainings, giving psychosocial support. And it shouldn't end with training, because after training, your staff will be exposed to the reality of a lot of things that have been deterring their optimal performances, and they will need help. So you should also think on collaborating or engaging mental health institutions or facilities or NGOs that can provide essential psychosocial support to your organization. This is when you will have it all figured, because it is not all sides work stuff, because by the time you expose your staff and your organization to this training, you will notice that there are a lot of gaps. And it is not just one side thing that should fit into all the staff or should fit into the organization structure or operations. I think you will need professional guidance, you need professional support. So I want to encourage business owners to open up their mind, open up the gates of their organization and institutions to seek partnership, to seek support, to seek collaboration with mental health institutions to drive, this prioritization of mental health at workplace, this investment of mental health at workplace. You see, by promoting good mental health, we promote the ability of everyone to fully participate in the society, whether in their social network, whether at the workplaces, whether in school, whether in communities, whether in families. So promoting mental health or investing in mental health will not only end at the workplace, because as you're already aware, or as our listeners will already be aware, it is not only what happens in the workplace that affects productivity at workplace. Other sectors are also very vital. What happens at the social network or the social community, what happens at the family, what happens in school, what happens outside is also, could also serve as stressors, could also serve as risk factors to hampering the optimal productivity or performance of staff at workplaces. Yeah. So my point is, let business owners engage mental health institutions, mental health organizations, mental health foundations for services, not only training. Training is very important, beyond training, services also.
We need to take one more message as we prepare to wrap up the show this morning. Ngozi sends a message. She says she is a banker. She has a newborn and she has resumed work. So while she's at work, she's thinking of her baby at home and this has affected her productivity and her mental health as well. What advice can we give to her?
Okay, thanks a lot for sending in that message. One of the things for us, as the mandated employment initiative that we also drive is maternal and child mental health. You see, the issue of maternal and child mental health is very critical. And this is why, again, I would also quickly like to mention that organizations and institutions to please try to mainstream or to also include mental health care in their policies. It's very important that it's well encapsulated. It should be enshrined in our organizational policies, because cases like this will always come, and that the welfare of your staff is very paramount. So please, because we've had a lot of postpartum depression cases, we've had a lot of such cases, and it did not only affect the work productivity of this individual, it ended up affecting the family cycle, it ended up affecting their lives. And then, in fact, some cases we've seen where the mother of this baby will almost want to kill the baby because she wants to be free. So it's very critical that we prioritize that now. But my word to you is, please, if you can write to your HR and explain to him your state. We understand that quite a lot of our HR management are not, are knowledgeable or exposed or experienced or willing, to prioritize mental health in their work cycles. But if you can explain to your HR manager and give him reasons to why you might need a break and why you might need, some moment to attend to your mental health, it will be very good, because until you have this time, you might not be able to get the required services or attention that will attend or that will help, manage your situation at the moment. So that's my counsel for you. And once you're able to get that permission and that space or time, then you can reach out, and I'm sure you will get some services that will help you return to normalcy. Thank you.
Great.
All right, Chinyarugo.
Thank you. Mr. Zion, just to wrap in the conversation, what are the possible hindrances that organizational and institutional levels that we should look out for when it comes to investing in mental health?
Okay. Some of the barriers, right? You see, there are actually, funny enough, a lot of barriers, to mental health investment. One of the things that I would like to start with is low policy priority. Like I just mentioned in my last statement, quite a lot of work institutions, organizations do not even have policies that mainstream mental health care or that give attention to mental health prioritization. And so one of the things that we have seen, historically, it has always appeared that mental health has been a low priority, both at national policy, at the national policy corridors of power, and even with the external donors or international development partners. It's been like that, but we are hoping that it's going to change. And as a person, as a mental health reform activist, I believe this will change. So we see one of the barriers, one of the hindrances, is low policy prioritization. We also see that the absentees, of need-based policy assessment. There is no proper need-based policy assessment, at most organizations or in most organizations, which is because of the lack of epidemiological data. There is no data that is available to be able to help, to guide or to support, the prioritization of investing in mental health. Of course, we have also seen that insufficient resources is there, because even at the country level, of course, we are seeing that countries accounting for more than 2 billion, of the world's population. I'm referring to Africa. Spend less than 1% of their total public sector healthcare. on mental health. And this is appalling. This is really appalling. Only 51% of the world population in low-income countries have access to any community care services. This is appalling. So these are some of the things that are hindering or serving as barriers, to mental health investment. Insufficient resources. I mean, it's very clear across the continent, particularly in Africa, that, you see, insufficient resources have clearly enough the gap we see, in the investment on mental health that we are clamoring for. And of course also information on effectiveness and cost effectiveness. Are you with me?
Yeah.
And the limited level of resources committed to mental health treatment and care is also a problem. Yeah. Right? It's also a serious problem. Poor distribution of available resources, which often is mainly concentrated at the urban setting, is also a problem. Yeah. We need to see even proper distribution of available resources. Right? Of course, I've mentioned that we have insufficient resources, but the resources that are available should, again, be evenly and properly distributed. It will happen. It will happen. I don't know if I have 1 more minute. I can also tell you again some of the impact of mental health investment. It is okay.
We've kind of run out of time at the moment. But I think you have shared quite a lot of information that is very important to the conversation, and I hope that the people listening, I know the people listening have taken a lot from what you have said. So I think I'm just going to hand it over to Victor to wrap up the conversation.
All right. We'd like to get the numbers and email to contact for psychological support.
Great. So I'm going to just give you the Neem Foundation Sanctuary contact number for you to reach out to us. The number to call is 0706 062 5054. I'm going to repeat that again. 0706 062 5054. And then just a reminder that this number is just for psychological support. And even in the times that we are in and all the things that we're going through in the past couple of days, I'd like to encourage you, if you find any of these images or any of the stories or any of the videos really overwhelming, please call this number for psychological support. Other things that you can do is just limit your engagement in social media, limit your engagement with the news. If you find it very overwhelming, try to stay in touch with people who give you some sense of peace and some sense of relaxation, and just try and do things that make you feel good. It's very important right now to actually apply self-care and use self-care, because at the moment you might just think it's just a video, but you don't know how much of an impact the things you're consuming at this moment may have on you. And I know a lot of people have already complained about the impact that it's having on them. So please take care of yourself while we still fight for a better Nigeria.
Awesome.
We must thank you very much, Chinyerugo Densi, clinical psychologist at Neem Foundation, convener of the Mind Clinic. Thank you very much for being a part of the show today.
Thank you, Victor.
We must also thank the founder, the Mandate Health Empowerment Initiative, Amy Zion Abba. Thank you very much for coming on the show.
It's good to always be here. Thanks for having me.
Thank you.